give a round of applause to the
came through for me, and I was able to purchase 20 diaper bags to give away with all these items in it for a newborn. But most importantly, I wanted to equip them with life-saving measures, which is the naloxone and aka Narcan. But I just wanted to educate mothers on the harms that could come with your child being in the care of other people that you don't know what they're doing, and just to be prepared and to educate them. So
as today, you guys, there is no, there's no rule, no policy, right? There's no policy that says these Narcan, the Narcan bags, the kids should be required as a take home. Oftentimes, you know, as moms, when we give labor, we bring these little humans into the world. We're given a prescription medication, and oftentimes it's what? It's a narcotic.
Yeah.
It's a narcotic. So as we know, narcotics, that's what naloxone, Narcan, it can be used on, right? Is a narcotic. So if we took fentanyl off the table and we just thought about, I know as a mom myself, let me go ahead and turn that camera around. Let me tell you.
Right.
When I had my little geniuses, I was out of it, right, moms?
Yeah.
I was out of it.
Definitely.
Yeah. Okay. And my daughter caused me the most pain because I had a C-section, and I can imagine accidentally taking more of a narcotic because the pain was excruciating. And I think about what if I took more accidentally and this wasn't available. Now, some people may be sitting there like, oh my gosh, it's not gonna happen.
Right.
It's rarely gonna happen. But rare doesn't mean never.
Exactly.
Yeah. Rare doesn't mean never. Rare means that there's still a potential. There's a potential opportunity. Another situation that can come up is, you know, my mom shared when me as a baby, because I don't think you all would think it's surprising, but as a baby, I got into some of her medicine as a baby. You know, now we talking about 1979, right? The first thing she did was she decided to run to the hospital. She was like, oh my God, my baby got into my medicine. And she felt comfortable enough because she didn't think I'm gonna come into the hospital and someone's gonna say, I'm calling Child Protective Services on you because you're a terrible mom. Right? She said, I need help. And the society and the world we live in right now, it doesn't feel welcoming to walk into a hospital and say, I need help. A lot of us, including myself, I don't know your experiences, I've walked into doctor's offices, and as soon as I say pain, it's like the eyebrow go up, or they start looking at me funny, like they're seeking something. Like, right? It's an experience we're all running into, so a lot of people are not quick to run. As we teach people that hospitals and systems are being held accountable to do what they're supposed to do, which is to help and to serve our communities as we teach. At the same time, we want to make sure that these things are available, because while you're dealing with the fact that you don't want to engage these systems, we don't want another life gone.
Right.
And it's unfortunate what happened. When I learned of Ashley's story, it broke my heart on so many levels. The biggest part that broke my heart is that it's preventable.
Yeah.
This can happen to anybody, regardless of your recovery journey, regardless of whether you have substance use disorder or you're a person who uses drugs. And I'm gonna tell you right now, if you use Pepto-Bismol, ibuprofen, Tylenol, join the club. And if you're a coffee drinker, if you're a cigarette smoker, or a Black and Mild holder, then you are a person who uses a substance. And if you put sugar in anything, like you like none of those things apply to me, but you eat spaghetti and you have carbs, you are potentially dependent on a substance called sugar. which is not regulated here in the United States. So, for all of us, we are all a part of this. So when I think about what happened and I think about our responsibility as an agency is to step up and teach communities. And what's cool about the pivot that we're going to take tomorrow, we were going to do a walk, right? We were going to walk from Jefferson all the way down to Norton Children's. And I knew that I really like Ashley. Like, I knew outside of this that I like, because she's a pivot queen like me. I know how to pivot real quick. We go where the community is needed. Ashley came in here and said, you know what, bet, for cash, this is what we're going to do. We're going to show up at an event that's about mamas. How dope is that? That is so dope. I was lacking because we've been dealing with organizational stuff and dealing with systems and doing what we need to do. And Ashley picked up the phone and said, hey, we're going to find somewhere. And she called up the people that have been supportive to her. And thank you to Norton's Most program and them informing us of this event. Because again, we're not always getting everything on our news feeds.
Right.
But we want to let everyone know how important it is to show up at this event tomorrow at Algonquin Park from 10 to at least 10 to noon to learn more about Ashley's story and the new information that we are going to be talking about. Things that Ashley is going to be fighting for. She's got some bullet points, and she needs some people in her corner to get ready to speak to legislators during the next legislative session. And we're going to need you all supporting the people in the room, like for you all showing up. I appreciate you all showing up. I really do.
Thank you.
Everybody has a lot more. We have an expectant mama in here. I'm not going to point her out, but she said, "Damn." I actually got a prize for it. But, you know, everyone got something on their plate to be doing right now. We all could be doing something else, but you chose to step away from that something. Oh, there go my girl. You chose to step. She's on live now. Yeah, you didn't know you was walking into a live.
What's the party if I don't walk in and end up on somebody's live?
That's savvy. She's in the community. She does the work. She's also a Today's Woman nominees. I'm just letting y'all know. So there you go.
So Shreeta, she's gonna brag on herself.
It's okay. And again, she's not right. I think it's not here.
Yeah.
But we are here because Ashley is ready to share with the world again her baby story, and this time tomorrow we're going to be talking about the real pathway to healing in our community. I will tell you, if you didn't show up tonight for this live event, the individuals in this room is going to learn about it, and we're going to turn the live off because you're not going to learn about it, but you can come tomorrow and hear about it. But everybody that showed up here will learn because they can start reflecting and thinking about how they want to be involved. And we're talking about putting boots to the ground, real feet to the pavement, because harm reduction, you guys, is why we are here, but they're trying to silence us. They're trying to push us in the closet.
We ain't going quiet.
We ain't gonna go quiet. We're gonna go boxing, kicking, fighting.
This program has helped me on my healing journey tremendously, from the supplying the Narcan to being an ear to showing me love to giving me events to come to and spread my son's story. I mean, I don't really think my journey would have gotten this far, and I would have done something so meaningful without this program. So I'm in the fight with you.
Yeah.
I'm definitely in the fight with you. This is this is a life-saving it's a life-saving program that's I've seen make a change. Like, you know, to know that my baby's 35 diaper bags all got handed out with 2 that are still, like that's 33 lives that's potentially saved.
Yeah.
And I'm with that. I wholeheartedly support this program. If I would have knew my baby died, he would probably still be here.
Yeah.
So I'm with you.
So I'm gonna start a little trouble real quick because Ashley's live is on here, and I got something to say. You know, it's never gonna be a moment where I don't have shit to say. I watch Ashley's live, and I don't jump into the conversations often, but I need to let you all know something. When you come after a grieving mother, and you never had the opportunity to walk in their shoes, I need to say to you, be grateful that you don't. When you come after a grieving Black mother, she got an army of folks behind her. And I say that because I've seen some mean things. I've seen some hurtful things. And I'd be remiss not to speak on those things. We don't understand fully why this is happening collectively in our communities. We don't understand why Narcan can't be treated like COVID during the pandemic. Right. Like we can't understand, my bad, let me back it up. We can't understand why fentanyl can't be treated like COVID was, right? To the point where we were giving out free items in droves. We don't understand that, but I do. Right. It's racism. Right. It's systemic. It's discriminatory. So I just want to bring attention to the folks that have been following Ashley's story and unpacking things that you think you know about what she's had to live through. Come pull up on us tomorrow. Talk to us directly. I'll be there with her so we can have that conversation. If you really want to understand why her baby was in a situation, come talk to us. Come listen to the real story, because I was told years and years ago by my daughter's past aunt, her aunt has passed, never say never.
Right. Yeah.
Never say never. And I don't want to say that. I don't want no one to have to experience what this mama and some people have had to experience in this room, the loss of friends and children, nieces, nephews, because of something that actually is not our problem. Don't get it twisted. The war on drugs has been a failure since it started over 50 years ago. And the moment that I fail at my job, I would lose it. But you cannot begin to help me understand how the damn DEA still have jobs. Right. And lives, hundreds of thousands, continue to die or be incarcerated because you choose not to put money into prevention. Harm reduction is prevention. It's always been prevention. Back when the Black Panther Party decided to give food to children. Yeah. Back when AIDS Act Up started and made sure that people got the medication they needed so that they can live. Right. Back when heroin users in California and young lords got with the Black Panther Party and started making sure that people could get acupuncture and other aids, other health aids. Or when they had a free healthcare clinic. That's what they won't tell you, is harm reduction has always been prevention. So when you got a problem with our community and people who have been hurt by things that they're out of their control, I need you to pull up and talk to me. My email is public. I welcome conversations. We're not afraid to have those tough conversations, because out of tough conversations, people are empowered with education and no longer ignorant. So please, be kind. Be kind. It's been some mean things said to you, and you don't deserve that. And I wanted to publicly make sure I said that to you. And I know people have been on your side.
Yeah. Yeah.
But it's awful, and we cannot just negate that and skip over how people harm each other with the words that they use.
Man. Yeah.
All right.
My girl.
So listen up. Today, we're going to stay on live a little bit longer. If you have some questions, I saw a few people hopped on my live. You want to talk to Ashley. If you want to come on screen, let us know. We'll bring you on screen to talk or ask questions. Some of the ladies in here have stories that they want to share. They're open to share why they're here, why it's important for you to be here. I would love for people to know what made you show up today, and then we're going to get to packing some stuff. Anybody want to share what brought you here and why are you here today? Why did you choose to show up? You don't have to say your whole name. I don't have to know all that. I have to know what your information is. But you do what you need to. And if you don't want to, that's cool too.
And be proud of your sobriety.
Oh, of course. That's right. Come on, girl.
My name is Heidi Jones. I am 2 years sober today, or like well, in March.
Yeah.
But actually, her story has moved me. I show up for all of her events, and I'll continue to show up for all of Cash's events. It's tragic what has happened to Cash, and other mothers need to know about it. Like Shreeta said, there has been mean people writing on her posts and just pure ignorant that, you know, some people don't understand about addiction. Some people don't understand about the epidemic of this city. Like, it's not just Louisville. Like, I was raised in Rensselaer, Indiana, and it's there. In a small city of like 2,000 people. So it's there, it's everywhere, and you know, and it's just the only thing that, like, you know, Ashley makes changes, but like there's some people out there, some mothers out there struggling, and the same exact thing happened to their child. And I know that other mothers have reached out to Ashley because I've talked to Ashley about it, but they are not shaking the world like Cash is.
And Heidi helped kick this off last year when, Ashley, I know you're not gonna brag on it. I love the humbleness of my sisters and brothers in sobriety. It's like, nah, they'll be out here dishing out all kind of cash and service work, and they be like, nah, I don't want to know. And I love that. It's a selfless act. But Heidi really supported Ashley. And tell me, Heidi, did you have to be completely bonded to Ashley to jump into this support?
No, I didn't know her at all.
No,
And I just jumped in.
she didn't. She did not.
You do not have to. You all to offer support and jump in and help each other because we're humans.
Yeah.
We're all connected. You know, and there wasn't video around for Heidi to do it. We're purposely doing video today because we're going to be loud about ours. We need to let y'all know what harm reduction really is about.
Yeah.
But there wasn't no video. There's no receipts. There's no proof. But I was in the room, so I'm going to say it. I was there from the beginning when Ashley said, this person's reaching out. And that, bro, I don't know who these folks. I said, they love you because you're human. So I just want to share that even if this is your first time hearing about Ashley, even if you had never heard of us or you just want to show up and listen, there's nothing wrong with that. Please show up. That's all Heidi did.
Yep, that's all she did.
You know, we bonded a friendship. You're invited to each other's weddings.
Yeah.
I wasn't invited, y'all.
Yeah.
I wasn't invited to the wedding.
I went to go to her wedding the next day, and she got married the day before. I was livid. I was high. I was so upset about that.
That was a beautiful story of friendship and love.
No, she came up to me when you called me and said, I need your voice down here at 6th and Jefferson. Can you come down here today? And at the overdose awareness event. And I just got done with y'all marching. I was in front of town square. I was down there with your signs. And she walked up to me out of nowhere and was like, I know your son. Yeah, I've been following your story. I heard about you. I want to tell you I'm sorry. But I fully support you, and as she did exactly what she said, she has been supporting me since day one. Like, she's been my rider. So.
Yeah, Heidi's actually a great example of actually walking recovery. Like,
yeah,
she's a
beautiful
walking
example.
And bringing people with you.
Yeah.
You know, it's
she's
so
going strong, ain't she? Yeah, I
look at
love
her
it.
blushing over there.
They say fight for your recovery like you fought for them drugs. So.
Hey,
yeah. Yeah.
Anything else you want to share with folks? I'm looking on here, folks. Heidi. Anything else you want to share?
Join us tomorrow. I'll be there. And I'll bring some clients with me.
Awesome.
You want to say something? Let me know.
You want to say something?
Oh, okay.
I don't want to put you
You're
on.
only as sick as your secrets.
Yeah, well, yeah. Yes, it's going to be at Algonquin Park in Louisville, Kentucky. For people who are following me, my folks who's doing harm reduction across the United States. If you want to support Ashley, she has links for direct donations. If you only have our link for KYHRC, you can put what you want to donate to and support. We don't have a title for this yet, but if you're saying for Baby Cash, that would work, and we will make it happen because again, there's some things we're kicking off. This is the beginning of some new efforts, so financially there will be things she's gonna need.
This is his favorite Paw Patrol character.
So,
I'm sorry.
that's okay. So if you wanted to share why are you here today? What made you come?
Well, Heidi had told me her story, and I had a little cousin that actually had died from the same thing, and
Wow.
they tore me apart. And they just tore my friend. She ended up going to prison for it. They charged her with neglect of a dependent, and he also had he was autistic.
Autistic.
So that really put a lot on her. They tore her apart. They had her all
How old was she, if I can ask?
she's 27. She was 26 when it happened.
Okay.
They heard about it. They just went off like that. I was there. I wasn't there when it happened, but like I was there with her raising him. Like that was my baby. Like that was. But when it happened, like nobody really knew her. Like I knew her. So then, like when social media took a part of it, they tore her apart. When I tell you, I almost replied to every comment. And I couldn't, because they were like, well, if you were there, you could have prevented it. Then they started getting on me about it.
Yeah.
And so, but, I just realized I can't control everything that people got to say. People, they just started getting on her, calling her all types of stuff. Bad mom, she's one of the greatest moms that I know. And now she's been sent to prison for 18 years. By accident.
Yeah.
So, yeah, that really was a lot of her just for like, really.
Yeah.
And then me being 2 months over and then I bring a baby in there, I can't imagine. And then also, I'm already a statistic. I'm a black single mom, first baby. So I'm already feel like I'm a statistic.
Yeah, you got it. You got it.
Statistic
Yeah.
in this type of community. I mean, just single moms, period. But then me being, woman of color, that just brings a lot into this. So, I don't really have a support system. I mean, now being sober, my sober family I do now. But
Yeah, that's good.
it's just hard. It's very hard. And then when you expect people to come together and uplift, and it's just like so the opposite of that. It's like rare. It's very rare for all of that.
You're the reason I do this.
And she's the reason that I'm trying to do this, because I don't want no other mom to have to go through that. And she has to sit in prison for 18 years off her an accident.
This is why
there was
want to
Narcan
get
in
Narcan in diaper
It wouldn't have
bags.
happened.
That's my message. That's my message. If Narcan was in my baby's diaper bag, he would be here today. And
Thank you for sharing.
Yeah. Thank
Sharing
you.
that.
Yeah. Come here.
We can do hugging today.
Yeah.
What you
That's
all
my
just
mission.
heard, this new mommy to be share is definitely what kicked off between last year and this year, which is the new policy and legislation around fentanyl. And it's criminalization of substances. So here's a real quick, breakdown in my layman's terms, but I want to encourage you to go read the policy yourself. Fentanyl is a substance that a lot of people have had, if they've had surgery, a major surgery, a major medical procedure, right? When the criminalization of substances occur, meaning they schedule the drug and then now put a charge on that drug so that people can be held accountable through the penal system, the court system. When they do that, it pushes people who use drugs, people in those spaces, to now seek other ways to not have to go to jail or be criminally charged. Also, fentanyl is a little bit cheaper, right? Access to it is cut in pretty much everything. And what I believe in my way, in Shreeta Walton, no connection to any organization, what I believe has happened is we are utilizing the same framework of the war on drugs, which is we're going to scare you. We're going to threaten you with time to get right. For 50 years, we saw that didn't work. So over the last year, the Halt Fentanyl Act has passed, And what that means is if an individual succumbs or has a fatal overdose, dies from intoxication or having fentanyl in their system, the responsibility will fall on the person who gave it to them or who was in their, under their care, as the young lady shared.
Yeah.
Now, this is the thing. No one is saying people should not be held accountable. What we are saying is that the supports, the funding, the work, the resources should be invested on the front end. Like making sure that every parent that leaves a hospital with a newborn and prescriptions have access to Narcan. No questions asked. Making sure that in our treatment and recovery centers, that when people are leaving, not just the people who leave against staff advice or terminated, get fentanyl test strips and Narcan, but everyone that walks out that door. Because as a licensed clinical alcohol and drug counselor, what we teach people is that a return to use or a relapse could be part of your recovery journey.
Yeah.
Is to say that in daycares, since we have children and we know that youth are on the rise of being impacted by this substance or any substance in our community, that daycares have access to Narcan.
Yes.
Is to say that schools, as we see every month, students who get access to a few gummies here and there, get access to a couple of pills or any other substance, that we have access to Narcan in the school so we can prevent a death, so a person doesn't have to go to jail for the rest of their life. A 27-year-old going to jail for 18 years does what? There's no rehabilitation in that. And to gaslight people and say that they're going to invest in rehabilitation programs that they lied about over 50 years ago is not fair. You can't sell me the same shit. You can't. It's not fair. It's not working. It's not working. So we're seeing an increase of people getting criminally charged, which means that they're not learning how to prevent. We're not investing in that. So again, a lot of people have a misconception. And again, back to Ashley's followers, a lot of people, and even Ashley, she struggles with that because she's the mom, right? None of us can say something to a mom like, that's her baby. And I'm telling you, I crash out over mine, right? So yeah, she has every right to say everybody will be held accountable, including herself, because she's beat herself up enough. But to say that the only response that we have, which has been proven by data to be ineffective, is to incarcerate folks, is absolutely ignorant. And I feel sorry for that individual. Because there is no reform in that. 18 years and then what?
Right. Yeah.
And for folks with lived experience, who've been lived experience, who have been incarcerated or have experienced time in jail, can speak to the fact that you learn a whole hell of a lot more than talking about how to reform your life in jail. So I don't know. It makes me angry to hear that kind of story. At the same time, we do believe in accountability. We have Maxwell Mitchell here who's on Stay Live Stream, and he's live streaming now too. And one of the projects that we've been working on over a year, trying to beat our heads around, is how to truly have restorative justice. How do we truly, because that is a real concept, it's a real practice. Restorative justice is a thing. Right now, there are systems that have a hold of that. They're not operating it the way that we believe, the people in this room, how we would. We would operate it much more effectively. But restorative justice, how do we do that? Because yes, people are to be held accountable. You take something from me, you harm a family member, it's caused me an insurmountable amount of pain. Yes, then we need to deal with that. At the same time, what do we do to prevent those situations? And that is actually what we'll be talking about with Ashley and the things she wants to fight for and will need the people like you and the people online, the people that follow her, the people that follow me. I see that Savvy, my other Savvy, so that's Savvy right here, but this is Savvy Kareem Abdul-Shabazz, who works in reform penal system reform.
Awesome.
Don't knock me on not knowing exactly what your title is in that, but I know it's reform of the carceral system. But we need folks to figure out this part, because my thing is, we don't want to lock people up. And all the people who are on my side of that saying we don't want to lock people up, then I need y'all over here on this side to figure out how harm reduction is supposed to be implemented.
Yeah.
Because that's the only way it works. Because if I give you all the tools, like I used to tell people in treatment when I ran the treatment program, I'm giving you everything that you need. When you make a decision to do something else, that's on you. So you'll have to leave. That's it.
Yeah.
But when you give people the tools,
yeah,
magical shit happens. It's beautiful. Thank you for sharing such a hard story and your why. And I'm glad that you're here, because that is prevention. And you got a surprise today. Ashley, what are you going to be giving our lovely guest?
She's gonna get a baby cash diaper bag.
Yay!
Yeah.
And that's a cool thing, right?
Yeah.
She don't have to go search for it. She don't have to decide, I gotta go to, one of the pharmacies,
Yeah.
and
Or the
I
fire
gotta,
department.
the fire department, I have to walk to it, or I have to pay for it at the pharmacy, but I need to pay for, milk for my baby. I don't have to make a decision because I have it. I have it to my disposal, so if I need it, or if I need it for my fellow friend on the street. Has anyone in here want to share a story about using Narcan on someone?
Has anybody else?
Can
Wow.
you share it with anybody want to share it with our people? Because some people are afraid to share about using Narcan.
I mean, I've had it used on myself and used it on people.
If you
And
want to
I've
share.
I've had my sister who died 12 years ago on a bathroom floor because there wasn't Narcan.
Right.
They just left her on a gas station bathroom. And so, I'm very big on Narcan. It literally, it saves lives. It does. There's no evidence about it. I've been brought back 3 times.
Wow.
And I've had to bring multiple people back. And it's all a matter of being trained on using it, because there's a lot of things to it, like people with the nasal, if they're not breathing, you gotta make sure their head's back. You gotta, because they can't breathe it in. And that's what on one of mine, if my boyfriend at the time hadn't scooped me up, put me in a cold shower, I wouldn't have breathed in that Narcan. He said the minute that I breathed it in, it was fine, but it's all a matter of knowing how to administrate it. It's super easy, but you have to keep an eye on the person. Don't let them out of your sight, because if you let them out of your sight, they go right back into it. I mean, I've had to give people 2 or 3 doses, because once they started to come out of it, they went right back into it, depending on the strength of the fentanyl.
Yeah, I've heard of that.
There's a lot to it, but it does save lives.
Thank you for sharing.
Thank you.
I don't know if you're a hugger. I've been doing the hugging thing. I've been in this space of hugging. It's not my other thing, but I'm enjoying it.
Right.
Last thing. As I'm sitting here and I'm thinking, and I like to give voice to everyone. So the last thing is, I would love for you to share something with people. You got 4 different platforms going right now. There's a lot of people who have been paying attention to the work that we do, and so they're watching you. And if there's something that you've just been wanting to get out, if it's involving what you feel is important about pathways to recovery, that you feel is not being said, I want to offer you a space to share. It's not very often that people get to speak about what's important about your whys. So I want to give space to that. Anyone in the room, anyone, whoever's behind cameras right now, too. If there's something you just like, man, I really want people to know this. There's a lot of people paying attention.
Yeah, I knew it. I knew it. Look, you see, I'm trying to hide in the corner. I talk all the time. I talk all the time, Shreeta. I'm Savvy.
90% of everybody watching probably already know me. I work in the vein of harm reduction, working with individuals experiencing housing insecurity, houselessness, addiction, recovery pathways, thus there and all of the above. And I think, you know, the why is such an important part of the conversation because everybody has a different why. If somebody has experienced addiction, their why of how and they ended up there is so different, you know. I think there's a lot of misconception about people who use or have used substances, that a lot of us make that choice. I'm somebody who, as of January of this year, has 5 years in recovery. You know, and my why for using drugs looks very different from the next person to me that was in rehab with me or that sits in the meetings with me or shares space with me in any vein and walk away. And I think a lot of people who haven't experienced that have a lot of misconception. And I think they think a lot of us choose our addiction. And that's not what it is.
Right.
Because Shreeta mentioned a lot about the war on drugs. And we don't talk about big pharma. You go to surgery, you get in a car accident, they giving you opioids. And then one day they gonna tell you, you don't need them no more.
Right.
But they didn't know that dependency that builds. There's a lot of people who don't have insurance, they don't have access to health care, they have chronic pain, they're seeking pain management. They're not seeking to get high. That's not what a lot of us came into this for. We were seeking to heal something within us or find access to something that we did not have, that was not provided in our community, that we did not have the privilege or the access to, and that's snowball.
Right.
And in a lot of communities, you know, in Louisville, we're blessed to have a lot of resources, and it's still not enough.
Right.
I know Heidi, and we ain't met, but I know you mentioned you're from a small town. I'm from a small town. I'm not from here. I'm from Hodgenville. You know, a lot of these communities don't have those resources at all. You know, and it's a shame, it's a stigma. We don't talk about it because there's all this connotation that nobody cares what my why was or what the next person's why was. So, you know, I challenge everybody, especially if you're somebody who has, you know, been privileged to not experience addiction or have a family member or friend who's experienced that, you know, to look at these types of stories and experiences out of a lens of curiosity and not judgment.
Right.
You know, I think if we all came into this with more curiosity rather than judgment, we'd be leaps and bounds further because now somebody has a chance to explain their why.
Yeah.
Right.
You know, and I think that's the big part, that's the important part. And Shreeta said something about never say never. You don't know, and it don't gotta be you personally.
Right.
A sister, a mother, a friend, a child, a brother, a cousin, a neighbor, a pastor, a teacher.
Right.
Everybody can be affected in one way or the other. And it does not take somebody saying, this looks fun, I'm gonna get addicted to it.
Right.
It's not that. It's not that. It's not that simple. I'm sorry. And you know what? The reality here that I want to be clear on too is there are people who choose to use drugs.
Yes.
Yeah.
And that's okay. That's okay. That's their right. I choose to drink occasionally.
That's your right.
That's my right. It's legal. I can go buy it.
What they did choose
And
is
for
to die from fentanyl.
That part.
They didn't choose
They
to
did
die.
not
They
choose to
didn't
die from
choose to
fentanyl.
die. Somebody who drinks too much and stumbles and falls in the river or
They
busts their
didn't
head did not choose to die.
Right.
That's right.
Nobody chose to specifically end themselves out of a good time. Nobody chose.
Right.
But even for individuals who do choose to use substances, they deserve access to resources, they deserve love, they deserve whatever they need in that moment. And they deserve non-judgment. They
Right.
deserve love, they deserve care, they deserve to live, and they deserve to live their truth.
Yeah.
Yeah.
So that's my why, that's my, I'm gonna step out.
Amazing. Yeah. You did great.
Shreeta be
Thank
sick
you
of
so
me, y'all. I
much
be
for
forcing her
helping
to
me
help
out
me.
with this mission. I really appreciate it. I'm looking forward to tomorrow's event on this Angelversary, but you guys
Remind
showed
them
out
again
for me.
where.
It's gonna be at Algonquin Park here in Louisville, Kentucky at 10 to at least 12.
Yeah.
So, and anybody know of any pregnant women that they don't have to be involved in substance use right now, but anybody that is a relative or that's pregnant right now with a small child or that's pregnant and would like to get a diaper bag from Baby Cash. We have 20 of them to give out, 19 now because we have somebody that's gonna receive a diaper bag today. So, but yes, most definitely come out and join us and see where we can help you guys.
Thank
you. Have a
you.
good one.
The flyer will be made available on my platform to you guys.
Awesome.
I'm gonna log off here. We're gonna log off on all platforms. See you guys on KYHRC. Donate. All right. Thank you. Stay alive.
$40 save a life.
Yes, $40 save a life.
Awesome.
Thank you, everybody.
Thank you guys for joining. Hey,
Every note, every performance, the arts connect us. The arts connect us through joy and through awe, bridging cultures and generations. From intimate theaters to the grandest stages, the arts bring us together, reminding us that we're never truly alone. When we experience the arts, we experience each other. Kentucky Performing Arts. The arts connect us.
Welcome to Skills for Life, located at 204 East Jacob Street.
She's holding on.
Here at Skills for Life, we offer services 6 months to 12-year-olds.
Tell me what this is. This is the what? The front of the book?
With a warming environment, a comforting atmosphere, with therapy services, social emotional learning, plant-based meals, and more.
Parents can look forward to having their children in a safe environment.
Join us at Skills for Life.
So you cannot check.
We have a plant-based diet that we serve, meals that we serve to our children, and they can expect that their children are safe and loved.
And for more information, call us at 502-822-3975.
If you do nothing else.
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 Stay live.